ready? Is it on?
You're looking right at it. The
What?
red light.
I don't know how to tell.
You don't see it?
Oh, it is on. All right.
All right, well, so I'm Donna. This is Kathy. We've been married for 45 years, and it's been the best 45 years of my life. How did we meet, you ask? Ugh, what a dream story. So we were at the club. We didn't know each other yet, right?
Mm-hmm.
I was on one side. I was getting my jig on, having some...
She was drinking a Long Island iced tea.
because we're from Long Island,
Of course.
and we were of age. Then I had to do a double take because I saw you all the way across the club, and you were dancing like a queen. What do you think?
Of what?
Come on, the question he just asked.
What did he ask?
How we met.
Oh. Okay. Well, let's see.
Jeez, just goes right over your head, I guess.
I forget things sometimes. I'm old.
Sometimes.
I'm old. Okay. We were at a club. I was drinking. She was drinking. And then.
Come on,
and
come on.
then- Well, you already told them. Why do I have to tell them again when you already told them?
Maybe in your mind you had a different picture of how wonderful it was, so I didn't know if you wanted to tell the people, the nice people behind the camera.
We were dancing. We locked eyes. And that was it. We've been together 46 years since.
This, just
Like that.
all right then.
Where are we from? I'm from Long Island. Donna is also from Long Island.
Long Island.
And that's it. What else do you need to know?
That's it. I'm a little confused though. Why did you pause? We've been married for 45 years, and you were like, Donna's from, and I had to give you the Long Island symbol.
I forgot. We've been together so long. I forgot
Well,
what happened before we met.
That'll pass for now, I guess. Till we see the nice doctor lady later.
I don't need to go to the doctor. Sometimes I forget things,
Sometimes.
but I'm old. I do everything in this house. If it wasn't for me, this woman would not be here today. She would not be alive. I keep her around.
That's a little dramatic. You're ridiculous.
What? What do you do?
What do you mean?
You're
what do I
always,
do?
you know why she thinks I forget things?
Tell the people.
Because I put something down, she picks it up, she moves it, then she tells me I'm losing my memory because I can't find where she put it.
No. You leave something out of the ordinary on a table or in the microwave or in the freezer.
In the freezer, really. Really.
You have done that.
I've never left anything in the freezer. I don't even go in the freezer.
No, she does, because we're looking all around. All of a sudden, I'm like, I need to make the pierogies for tonight. So what's so funny about that? See, she's
You
losing
know
her
how
mind.
I know this story's not true? Because I don't even eat pierogies.
What the? What are you talking about? You don't eat pierogies? I'm sorry. Those are just a tradition in our family, and the fact that she's saying that right now is hurtful. So this is how you know.
Never eaten a pierogi in my life. No, I like a pierogi.
You're saying you like it or you don't like it?
I do like a pierogi, I just don't eat them often.
I'm laughing because you sound crazy. Look at this crazy one over here, giggling like it's some type of joke. I open, get the pierogies. There is the key, the house key, sitting in there right next to the pierogi. Dishes are dirty.
Donna, did you start dinner? I gotta do everything around here.
Today's dilemma is we can't find the house keys. So we're gonna look in the typical spots. Let's go. So the first place would be the microwave. Nothing. Open up some cabinets. Cheese jalapeno. And finally, I know it's gonna be in here. What do you know? The house keys in the freezer. I don't know, man. We cannot wait to go see Dr. Angelica Hernandez on Monday. We cannot wait.
It's hard.
I'm Donna, Kathy's wife, and these are my daughters.
I'm Rachel.
I'm Charlie. We're here today because we're really worried about Mom.
We're worried about her.
She's been having a lot of problems recently.
Yeah, like we said before, she forgets everything.
She never knows where her keys are anymore. So we decided to come to the doctor now because Mom takes the same walk with the dog every day. And a couple weeks ago, she got lost. All she does is walk around the block with the dog every day. And she's done it for 25 years. And she got lost. And it was really scary.
It was really scary, yeah. It worries us because she could be out and about doing her thing and we're thinking she's okay, but she's out there getting lost, so.
And sometimes she leaves the house and we don't even know. She won't even tell us anymore.
She doesn't, yeah.
It's scary.
And she used to be way more active in the community. I mean, you used to take her to.
We used to go to dinners, we used to go bowling, all of her groups, and now if I bring it up to her, she's always like, no, I don't want to go.
I know, doesn't she seem like really mean all the time now?
She seems kind of agitated recently.
Yeah.
She definitely seems different.
We moved back home from after college and everything because of how bad it's been getting.
Yeah.
We'll offer to help because clearly she needs it, but she never lets us help her anymore. She'll burn the food or she'll walk away, leave the stove on.
Yeah.
But we'll try to help, but she doesn't want to hear it.
And she doesn't really think she's doing it either, but we know she is. So.
Yeah. She'll go to the store and she'll forget why she's there, but she won't let us help her make a list.
Yeah.
We're trying to keep her schedule the same every single day because of that, but still, it's not really doing enough.
Yeah. Yeah, so basically, that's why we're gonna see the doctor, Angelica Hernandez, tomorrow. Are you ready for this?
I guess you and the kids have been bothering me forever.
I know, I'm glad you're doing it. I really am.
I know.
I really am.
As long as it makes me feel better.
It does, it really does.
I'm just ready to get this process started, you know? I'm ready to get it finished. Yeah, well, maybe. Oh! Hello there.
Hi, ladies. My name is Dr. Angelica Hernandez.
Oh, nice to meet you.
Nice to meet you. Nice to meet you. Okay. Let's get this started. So, what are we doing here today, ladies? What's going on?
Well, tell her. My family's been worried about me. They think I'm forgetting things. I don't think I forget anything,
Okay.
but my wife's very concerned.
I am. I mean, it's just, you know, day to day things. Every day something new happens where she forgets she left the oven on or she misplaces the keys in the freezer and I cannot believe it. So I know something's got to be happening and I heard you're the best, so.
Okay. Those sound like pretty common symptoms that I see a lot.
So I've been
So
telling you.
Well,
we still want to check it out. We still want to make sure everything is okay. It just could be because we're getting to a certain age, but we're gonna
Oldie.
check it out. Okay? We're just gonna
You're
make sure
older
everything
than
is
me.
fine. I'll run a few tests and then we'll go from there and we'll see what happens.
okay, thank you. Thank you.
So I'm just going to ask you a couple of questions, okay? Just answer them to the best of your ability. If you can't do it, just say, I don't remember, or I don't know, okay? And then we'll go from there, okay? So, what is today's date?
Today is December 6th.
Okay. What city are we in?
We are in Syracuse, New York.
Okay, I am going to test your memory, okay?
Here we go.
So I'm gonna say 3 words, and I want you to repeat them after I finish, okay?
Of course.
So, ball,
Ball,
flag,
flag,
and tree.
tree.
Okay. Now, can you repeat all three?
Together?
Mm-hmm.
In a row?
Mm-hmm.
In the same order?
That's okay, whatever order you can come up with.
Come on, sweetie. Tree.
Mm-hmm.
Flag. I don't remember the first one.
Okay, that's totally fine. Great. Can you spell the word world backwards?
I don't know if I can spell it forwards. Well,
Just try, just try.
let's see. D L R O W.
Good, very good. Okay, do you remember those 3 words I asked you about earlier? Can you tell me what those were?
Let's see. I remember tree. I remember tree.
Okay, great. Can you tell me what this is?
A marker.
Great. Can you tell me what this is?
Oh, let Dr. Hernandez go first. Of course, of course. This is hand sanitizer.
And me. What's going on? Will you like some too? All right. Everybody needs some.
Yeah. That's actually all the questions that I have for you right now, so thank you for that. But I do want to order an MRI scan. An MRI is basically just going to show a picture of your brain so I can see what's going on and we can make sure that everything is totally and completely okay. And then we'll talk about the results and we'll go from there.
Okay.
Sounds good.
Sounds
Great.
good.
Thank you ladies so much for coming in
Oh,
today.
thank you.
Wonderful to meet you.
Thank you.
Have a safe drive home.
Yes, thank you.
Yeah, you had to wear those today?
Hi, ladies.
Hello, Dr. Andrew.
So great to see you again. Hello. Hi. All right. So, I was looking at the results of your MRI, and based off of everything that we did thus far, I do think that it looks like we have Alzheimer's disease. It's okay. No, don't worry. It's okay. So I'll explain it to you. So it looks like. Oh, do you want a tissue? Hold on. Okay. Right. You're welcome. Thank you. It's okay because it looks like we're maybe in a mild stage right now. Nothing too severe at this point, which is good that we've identified it earlier rather than later. It's okay. I'm sorry. Here you go. It's okay. What we're going to do from here, I think the next best step would be to talk to a speech language pathologist.
Okay.
Yeah.
What they'll be able to do is just give you some strategies, some coping techniques, things to help you and your day-to-day life, okay? So let me give you...
Day, you know, the daughters, they'll be able to help maybe
That'll make
more.
them feel better.
Yeah.
They'll feel better.
Yeah.
Here is my recommendation, okay? Give them a call.
Thank you, doctor.
Basically what we found is Alzheimer's. That is a form of dementia. Dementia is defined as a syndrome that involves multiple cognitive deficits that significantly impair a person's ability to function. Alzheimer's can be genetic, but it's likely a combination of environmental and genetic factors. It's caused by abnormal tissue changes and eventual brain atrophy in the parietal, temporal, and frontal lobes and the hippocampus. Plaques and tangles form in the neuronal tissue that interfere with the signaling and communication between the neurons in your brain. Because of these plaques, the brain can no longer form connections or synapses, which then therefore kill off those brain cells. Because of this cell death and loss of communication, short-term memory and long-term memory become a problem and you can no longer perform those functions. Some common symptoms that we see Kathy experiencing are restlessness and distractibility, executive functioning, impairment, poor attention and focus, forgetfulness, word-finding problems, impairments with reading and writing, and difficulty recalling events. Based on our initial visit, I ran the mini mental exam, and she came up with a score of 11, which would correlate to mild stage Alzheimer's dementia.
Boomer.
Hello, I'm here.
Hi, nice to meet you, Auntie. So the first part of this test, I'm going to tell you a story, and when I'm done, I want you to tell it back to me, okay?
All right.
When I tell you. So, while a lady was shopping, her wallet fell out of her purse, but she did not see it fall. When she got to the checkout counter, she had no way to pay for her groceries, so she went and put the groceries away and went home. When she opened the door to her house, the phone rang and a little girl told her that she found her wallet. The lady was very relieved. Okay?
All right.
We're going to move on to a different part of the test now, and then I'm going to ask you to tell me that back in a little while.
Okay.
Okay, so the next part of our test, I'm going to say some strange sounding phrases to you, and I want you to repeat them back to me. Tornadoes misjudged long egg booklets.
Tornado. Misjudge. Booklets.
Okay. High mountaintops chuckle sweet passion.
That one's a funny one. High mountain. Chuckle. I don't remember the rest.
Okay. Now, what can you tell me about that story that I told you a minute ago?
Let's see. A woman needed her groceries. She went to the supermarket, but she couldn't get her groceries, so she had to put them back. And then she went home.
Okay, I use this test here, which is the Arizona Battery for Communication Disorders of Dementia. It's a standardized test battery for the comprehensive assessment and screening of patients suspecting of having a mild to moderate neurocognitive disorder. This includes mild cognitive impairment, dementia, and traumatic brain injury. Dementia is a disorder that also affects your speech and language, as well as other areas of cognition. And we find that patients with dementia are less inclined to come to speech therapy, but we have seen that coming to speech therapy helps to reduce the rate of progression of the disease. We know that the disease will still progress, but with therapy we can help Kathy establish some good strategies that will aid in her day-to-day life, and this will also help her caretakers feel more at ease.
We're back! So, it's been a year since we've talked to you and our initial meeting with Dr. Angelica Hernandez and the speech pathologist and Drew. So since then, a lot has happened. We've gotten some great techniques from both the neurologist and the speech pathologist. Like the daughters are helping too, but they step back a little because we've come to manage it. There's lists that we write out of what we do each day. We have certain spots for everything in the house, so you know the pierogi and the key and the freezer situation.
Woman and her pierogies, I swear she's gonna turn into one.
Hopefully in my afterlife. What do you think about the whole process? What has happened?
Well, the daughters are relieved. They're very happy. They feel like their mothers are handling and managing, and we are.
Yeah.
They got me one of those new phones, so they can check where I am all the time.
The techniques that Andrew, speech pathologist, gave us have really helped us along the way.
Doing a lot better.
It's nice.
Me and this one.